There are two types of ear infections. The one that we see most often in the summer is something called otitis externa, an outer ear infection, but known generally as a swimmer's ear. Those infections are actually an inflammatory or an infectious process in the outer ear, and those are created by having water, whether it's pool water or lake water or ocean water, stuck in that ear canal. And because the water's there, it actually changes the pH of that skin, and that allows certain bacteria to grow into that space. Outer ear infections are treated with drops that we prescribe when we see you for an appointment. In order to prevent swimmer's ear infections, especially if you have a child that's prone to one, we recommend actually treating their ears every time they get out of the water. We do that with a combination, believe it or not, of vinegar, white vinegar, and rubbing alcohol. So it's equal parts of each. The alcohol helps things dry out quickly, and the vinegar changes the pH, so it makes that ear canal much less likely to become infected. Sometimes you'll see swim lessons or kids who've been on swim teams, the coaches are kind of squirting those things in, but there's no reason you can't do it. And if you don't feel like mixing alcohol and vinegar at home or finding a medicine dropper, they actually sell it over the counter. I think it's called swimmer's ear, and it's already those two ingredients put in a bottle, more for your convenience. The other type of ear infection we see is usually year-round, and that's called otitis media, or a middle ear infection, or what people just generally consider an ear infection. And in those infections, the infection is not in the outer canal, but actually in the middle ear, so on the other side of the eardrum. So when we look at ears using an otoscope, we point the flashlight down the ear canal and look at the eardrum itself. What we should see, what we want to see, is a clear flap, a clear eardrum, which actually allows us to see the little bones and things on the other side. In an ear infection, actually that space is filled with either sort of clear fluid, a mucousy fluid, or actually sometimes we see frank pus, and that ear's mad. That eardrum is inflamed and bothered. The reason why children get ear infections is because in adults who don't usually get ear infections, the eustachian tube is practically vertical. In children, it's practically horizontal. So they get a cold and they swallow snot into the backs of their ears. In a perfect world, it would run out. But unfortunately, due to anatomy, that gunk can get back there in that nice space behind the eardrum, and that's where an infection builds. We treat those types of ear infections not with drops externally, but with oral antibiotics, because we have to treat them from the inside out. With middle ear infections, it's harder to prevent because it's obviously hard to prevent colds. We see more ear infections in children who are exposed to more germs, kids who are in daycare early on and things like that. If you're congested, sometimes just trying to minimize the congestion for a sick child could help prevent an ear infection. So in little people, when they're 6 months old or older, they can have some Zyrtec. As they get older, you could try a decongestant or things like that. But it's hard to prevent colds, especially with children going to school. If a child has had multiple ear infections, and that means more than 3 infections in 6 months, more than 4 in a year, or if when we look in their ears they have persistent fluid, which might be impacting their ability to hear well, those are children that may be a candidate for a surgical procedure called tube placement, myringotomy tubes, which are little ear tubes. And those are put in by an ear, nose, throat physician. So oftentimes in the office, if we see someone who's had those recurrent ear infections, we need to refer them on to ENTs to make an assessment as to whether that child would be a good candidate to get tubes. Always topics we're happy to talk about at Carithers at the time of an ear infection appointment or any other type of appointment if that's a concern to you.